If that leads to a much speedier process and getting a vaccine approved, then I'm all for it.
Tens of thousands of volunteers around the world say they'd be willing to be infected with COVID-19 if it meant speeding up the creation of a vaccine. At least one of those volunteers is right here in San Diego. Our ABC 10 News reporter Laura Acevedo spoke to that volunteer who says if approved, the risk would be worth it.
The process would involve a controversial study known as a human challenge trial. There currently isn't any such trial in the works, but these volunteers say they are ready to go if one is planned and approved. April Simpkins is a healthy 29-year-old who felt helpless as the COVID-19 pandemic started and spread all over the world.
I felt, pretty powerless to be able to help. I wasn't in an essential profession. And so it just felt like something very simple that I could do.
While listening to a podcast, she heard of something she could do: sign up to be on the One Day Sooner volunteer list.
I thought, that sounds like something that I would want to do. I'm young, healthy. I have no underlying medical conditions.
One Day Sooner is an organization that advocates for volunteers willing to participate in a human challenge trial. That means being infected with COVID-19 in hopes of speeding up the process for a vaccine, restricting the trial to people that are healthy and young.
Most of them are willing to, understand and accept that those risks are there, because they want to end this pandemic fast.
So far, there isn't a plan for any human challenge trials to fight COVID-19, but over 30,000 people have signed up to volunteer from over 140 countries. The trial would still require approval from a type of medical ethics board and the Food and Drug Administration.
The volunteers for One Day Sooner think that they are willing to take on risk to themselves if it means that the risk can be lower for other people.
But Simpkins says the risk is something she would be willing to take.
If that leads to a much speedier process and getting a vaccine approved, then I'm all for it.
Laura Acevedo, ABC 10 News.